Good morning, everyone. Welcome to Let's Talk Vaccines. My name is Bobby Adelson Jr. I'm the Public Affairs Officer here at the U.S. Embassy in Kingston, Jamaica, and I'm very lucky to be joined this morning with my colleague, Dr. Varough Deyde. Welcome to the program.
Thank you. Glad to be here.
So the topic of the day, of course, is vaccines. It's something that we're all aware of, we're all thinking of. And Dr. Deyde is the director for the Centers for Disease Control, the CDC, and Prevention Caribbean Regional Office. And he's also the U.S. Embassy's COVID-19 response lead. Now, the reason I'm going to read your biography, Dr. Deyde, is because it's quite impressive, but also because of the topic that we're speaking on, vaccines and COVID-19. I think it's very, very relevant to understand your background. So Dr. Deyde holds a master's degree in genetics and a PhD in molecular biology, virology. He has also co-authored over 50 peer-reviewed articles. He's been with the CDC since 2004 and has relevant experience after being deployed to support the CDC's response to the Ebola outbreak in West Africa in 2014 and 2015. So you have a lot of experience in this area. You are a subject matter expert. So tell us and tell the folks at home, why should we be getting vaccinated?
Once more, thank you, Bobby, for this opportunity and for this occasion to share some thoughts about the subject that you just mentioned, which is the COVID-19 vaccines. People should take the vaccines because, number one, vaccines have been with us for decades. They have been used to eradicate, to eliminate and control diseases. In particular for the COVID-19 vaccine, it has been proven, or they have been proven to be effective and safe, and they have been proven to prevent infection. They've been proven reduce the risk of infection. They've been proven to prevent severe disease, hospitalization, and death. That is why we should be taking the vaccines.
Thank you so much for that intro. And folks at home who are watching live, we'll have 20 minutes or so for the program. If you have questions about vaccines, you have questions about the coronavirus, COVID protocols, or anything like that, feel free to leave your questions in the comments, and we might pull them up and ask them live. So Dr. Deyde, you and I were both at the airport last week when 208,000 plus Pfizer vaccines arrived, donated from the United States. How will those vaccines be used here in Jamaica? And are we expecting any more?
Thanks, Bobby, for that question. Yes, as the Charge d'Affaires did mention last time, we were very happy and glad to see those vaccines arrive here in Jamaica. And yes, they are a first tranche of multiple tranches to come over the weeks to come. And from what we understand from the authorities here, they are going to be used, and they have already been used to vaccinate secondary school children, and that is an excellent thing. We believe this is, and as already mentioned by the authorities, it is going to contribute and facilitate the face-to-face learning of these students.
And again, how many more do we think we could be expecting from the United States?
Yes, well, we believe we are going to be getting a total of a little over 600,000 vaccine doses of the Pfizer vaccine.
And so it's a two-dose program,
correct.
so 300,000 roughly folks can get vaccinated based off those donations.
That's correct.
Awesome. All right, so we actually have our first question from the audience I'm going to pull up. Latoya Williams asks, how long will these vaccines be protecting us?
Thank you, Latoya. That's a very good question. This is one of the areas that we are still learning more about. Research is still being conducted, and data is still being analyzed to understand and determine how long immunity lasts after we get full vaccines completed. However, there are indications and there is data that the CDC has published recently that clearly shows that there is a diminution in the protection against getting infected especially with regard to the Delta variant. So that is something that data has already clearly demonstrated. We are still looking at whether there is a waning in the immunity also with regard to preventing the severe or mild disease.
Yeah, so you started to talk about this, but I wanted to ask a general question about efficacy of vaccines. How effective are they against COVID-19? And specifically, when you hear Pfizer's 95% effective, what exactly does that mean? And you started to touch on the Delta variant.
Sure.
Are we expecting that these vaccines, not just Pfizer, but the ones we have locally here, AstraZeneca, are these, what does that mean? What does 95% effective mean, number one? And then, again, the Delta variants that we hear so much about, are they going to be effective?
Sure. Thank you, Bobby. That's a very good question. So the effectiveness of the vaccines, this is all of the vaccines that have been approved by the WHO or the FDA.
Right.
All of the vaccines that have been approved today have been shown to be effective against severe disease, against hospitalization and death. In addition to that, these vaccines also have been demonstrated to be effective against getting infected or transmitting the virus against those original COVID-19 strains, the original COVID-19 virus. However, with the Delta variant, there is evidence, there is now data that shows that protection against the infection has reduced because of the Delta variant. Earlier, the vaccines have had about 80 to 90, up to 90% effectiveness against infection. And more recently, with the Delta variant, data clearly shows now that has decreased to about 66%, meaning that individuals who are fully vaccinated are still protected against severe disease, hospitalization, and deaths. However, they are now susceptible to some level of getting infected and to transmitting the virus.
Got it. And so I hear a lot in the news recently about booster shots. So are booster shots going to be a thing here in Jamaica, do you think? And how do booster shots kind of help that efficacy?
Sure. Thank you, Bobby. That's a very good question. So the booster shots are now in discussions, but they are not a recommendation that has taken place. There are no booster shots now outside of those who are immunocompromised.
Right.
Those who have diseases or have conditions that decrease their immune system's efficacy to fight, those individuals have now been recommended for a third dose, calling it not really a booster, but a third dose to complete their and support their immune response. However, for the general population that has received full 2 doses of the vaccines that are 2 doses, the AstraZeneca or the Pfizer or Moderna or others, those are not recommended at this point to take the booster shot as of today. However, the CDC last week did, and the HHS in the US did come out with information and shared information based on data that was collected and analyzed that showed, as I mentioned earlier, the probable diminution or decrease in the protection for sure, not probable, for sure, and the diminution in the effectiveness against the transmission. And there is a possibility also that mild illness also might have diminished. Protection against getting mild illness may have diminished. And based on that, they want to ensure we're staying ahead of the virus and are considering the booster shot at some point in late September. Mm-hmm. But that also is pending the FDA and the CDC review of the data at that time and approval. So just to say, as of today, there is no booster shot that is recommended for those who are fully vaccinated outside of those who are immunocompromised.
Thank you. All right, we got a couple similar questions. I'm going to pull them both up. One user asks, what about mask mandates for persons who are vaccinated against COVID-19? And then similarly, my mom, Dina Adelson, asks, how effective are masks today? Hi, mom and dad, watching back home in Daytona Beach. So then a question is, you and I both have masks on right now.
Sure.
We are both vaccinated.
Sure.
Do vaccinated people have to wear masks? And, of course, what are the protocols recommended by the CDC for vaccinated and unvaccinated people?
Sure. Thank you. That's a very good question. Prior to the most recent guidance, as you know, CDC and the Ministry of Health here in Jamaica and the WHO and PAHO, all of these entities and bodies do look at the data on a regular basis and do adjust their recommendations based on the data and the findings and the science. So prior to the most recent guidance that I will cover, the general recommendation was that those individuals who are fully vaccinated don't need to be masked. Outdoor, in general, that still stands. If you are outdoors, you don't need to be masked. However, if you are out in an outdoor event with a lot of people that you don't know who's vaccinated, who's not vaccinated, it is recommended that one wears a mask. Now, for those who are fully vaccinated, who are indoors, the guidance is the most recent guidance is based on the data that we just saw. A study out of Massachusetts that showed individuals who were fully vaccinated but indoors partying and not socially distancing with the Delta variant. It was shown that indeed those individuals who were fully vaccinated were infected and were able to transmit the virus. Now, given that situation now, the guidance is those who are fully vaccinated indoors, who are staying indoors, they, especially in areas that are of high transmission, in areas where there is a lot of virus transmission ongoing, it is safer for them to stay, better for them to stay masked, not only to protect themselves, but also to potentially reduce the risk of them transmitting the virus to others, but also to protect their family members and those who are not vaccinated. For example, the children under 12, potentially those who have certain conditions that prevent them from being vaccinated, etc. So all of this simply to say these layered measures all contribute to us really controlling the virus. And the good news, we can't overemphasize this, is that those who are fully vaccinated are protected against severe disease, from hospitalization, and from death. I think that's for all the vaccines.
Yeah, I wanted to follow up on that because you mentioned that it's possible for someone who's fully vaccinated to both get COVID again or get COVID for the first time and then pass it on. So I hear a lot of folks saying, if vaccinated people can get COVID and pass it on, why is anyone vaccinated? What's the benefit? You touched on it.
Yeah, very good question. So the importance is that, number one, they are less likely to get infected compared to those who are not fully vaccinated. That's the first. The second thing, even if they were to get infected, the good news is that the duration of them also being infectious, or the duration of them being able to transmit or infect someone else is also reduced compared to those who are not fully vaccinated. So that is the benefit of really getting the vaccine. We cannot overemphasize that. If you get fully vaccinated, you're staying out of the hospital, and you are not getting severe disease, are less likely to get severe disease, and you're not dying. So that's the real message that we want to ensure that everyone hears.
Gotcha. Now, I got a few questions that are similar here about travel to the U.S. And it's not exactly in your field, but I'm curious. Christopher Gray asks, good morning. Do you need the vaccine to travel to the United States? So have you heard anything about a possible mandate requiring visitors from other countries traveling that they might have to get the vaccine?
Thank you. That's a very good question. As of today, we do not have that mandate yet, but it is in discussions, it is in considerations, especially in the wake of this Delta variant and what we've seen. It is definitely a possibility. We don't have that as a recommendation at this point or implemented, but it is not impossible to see it implemented.
Got it. Okay, I'm going to talk about a few myths that I've seen on the internet that I'm sure we've all seen at some point floating around, misinformation and myths surrounding the vaccines. To name a few, I've heard people say that it'll cause you to be infertile, that it might be risky for pregnant women, that it actually gives you the coronavirus, or that perhaps the governments are conspiring to give you a microchip. So can you address some of these myths, especially the ones that are legitimate concerns, like pregnancy, infertility, or the question that, hey, when you're getting the vaccine, they're actually giving you COVID-19 at that point?
Thank you, Bobby. That's a very good question from the listener. Yes, some of the concerns are legitimate, and people's questions and concerns should be addressed. The myths, some of the myths have absolutely no ground, no truth to them, and no science or data behind them. On the issue of infertility, there is no data, there is absolutely no study or anything that shows that the COVID-19 vaccines cause infertility. The vaccines, none of the vaccines that have been approved so far have a live vaccine, therefore have a live virus. Therefore, none of these vaccines are going to give you COVID-19 disease.
Gotcha. Can you? I'm woefully ignorant to a lot of scientific things. So you started to talk about how the vaccine not having an active COVID-19. Can you just really briefly describe how does the COVID-19 vaccines that we have today, how do they work?
Sure. So the vaccines that we have are based on the basic fundamentals of priming our body to fight against the bug or the virus when we get it. And that is to take a piece of the virus, whether it is the genetic material, the type of, for example, the mRNA, if we're talking about the Pfizer vaccine as an example, a piece of that genetic material, and it is introduced in our cells, and it simply tells our cells to produce that protein, and that piece is rapidly destroyed. And it does not integrate, nor does it alter our genetic system or our immune system or our genetic makeup, as individuals might say. And once we are primed and we have seen the material or the protein that was produced that belongs to the virus, then our body is primed to respond when we are facing the virus. That is the general premise or the general construct of the virus, of the vaccine.
On the topic again of viruses and how they work, we got a question from the audience. From Kathy Wallace says, "Sir, is the AstraZeneca vaccine good?" So they hear about Pfizer. Are the vaccines that are here in Jamaica, are they all equally as effective?
Sure, absolutely. Thank you for that question. Yes, I have repeatedly mentioned all of the vaccines that have been approved as of today by the WHO and by the FDA are effective against, as I mentioned, severe disease, effect and protective against hospitalization and death. This includes the AstraZeneca, and it includes the Johnson & Johnson, and it includes the Pfizer, all of the vaccines that are here in Jamaica, yes.
Perfect. So moving slightly away from vaccines to kind of wrap up here, besides the 200,000 vaccines the United States has donated, and we're expecting maybe about 400,000 more, what else has the United States done to support fighting the pandemic here in Jamaica?
Thank you, Bobby, for that question. We've had a very strong partner, our governments, the U.S. government and the Jamaican government. And since the start of the pandemic, we've been by the side of the government. We've worked very closely. All of the agencies within the U.S. government that are represented within the embassy community here have engaged. We have provided, supported through the USAID, the DoD, the CDC, the INL, State Department. All have chipped in and helped in any way we could. We supported the emergency operations centers. We supported material communications in that. We supported patient care through ICU beds, and lab support was provided. We through the DoD have provided mobile hospitals, and really the U.S. government and the Jamaican government have really collaborated closely in this response, and we will continue to support not only in the short term but in the long term in the fight against COVID-19.
That's right. It's a whole of government approach. The Biden administration has been very clear that they're committed to providing the same type of service and the same type of help for folks overseas as they are for folks at home. I think it's a global pandemic that requires global solutions.
That's
so
right.
Thank you so much for being with us, Dr. Deyde. Do you have any final words for our viewers at home?
Thank you. Yes, please, as everyone had said here, and just echoing the calls from the Minister of Health, the Prime Minister, the Minister of Health, and the Charge d'Affaires the other day, and all the public health professionals and Chief Medical Officer, please get your vaccine. The first opportunity that presents itself, please take the vaccine. It is the safest way and the best tool we have to prevent and control this pandemic.
Well, thank you. You heard it straight from the doctor's mouth. Thank you so much again, Dr. Deyde, for being there. And thank you all for watching at home, and have a lovely day.